Okay, good morning Fiona, thanks for coming back to London Independent today. Could you please tell me what operation you had done and why a few weeks ago?
Yes, so I had I might need you to tell me, a jaw arthroscopy.
Yes, you had a right jaw washout or
Right jaw washout.
arthroscopy.
Yep.
What were the initial concerns? Why did we do it?
Yep, so I had an injury or something like that a few months ago back in February where I woke up one morning and my right jaw felt like it had laxed out of the joint. It didn't feel fully dislocated, but
Right.
it felt like I'd done something to the joint basically over the night, the way that I must have slept on it. And then over the next 48 hours, my whole jaw and neck completely seized up, all the muscles got lockjaw.
Okay.
And then I was on holidays at the time, so got some massage and an osteopath to sort of hopefully release the muscles. And then once I came back to London sort of 4 weeks later, it still hadn't resolved.
Yeah.
So saw yourself, we had a consultation and was sent to get an MRI, and it wasn't dislocated, but I think the MRI showed that there was the jaw wasn't completely right.
Correct.
In the joint. There was a lot of inflammation, and so I didn't have lockjaw anymore. But I found that I wasn't able to fully open my mouth how I normally would, and when I did, it felt like something wasn't right, and there was a lot of inflammation and gunk stopping it from opening normally, and was in a lot of pain day to day, ongoing for months by the time I was able to sort of see and get the MRI. So we had that, and we from the diagnosis sort of found that there was a good reason to go in, and I believe you sort of flushed out the joint.
Correct, yes. So I think we did it on the 26th of June, so we're almost a month,
4 weeks later
4 weeks now. And yes, so we found some inflammation in the jaw joint, we washed it out, we placed some medication into the jaw joint, and I want to ask you to show me some of your jaw movements.
Yeah, so it was the right side, so
post-surgery. So could you open your mouth as wide as you can? That's really, really good. And close again, please. And could you move your jaw from left to right for me? So your jaw movements are really improved. And are you back on a normal diet yet?
Yes, I am now. I'm being very careful just with chewing and sort of, if I chew a steak or something like that, or lollies that are particularly chewy, to not sort of overwork the muscle, and also not play around with moving my jaw too much. So we found that before I had the procedure, when I would open my mouth, even after lockjaw, when I was able to open it, it would deviate to one side. So it sort of be doing that when it tried to open. So it opens sort of straight now, but I'm trying not to test it too much. So I'm back to a normal diet, but just being really careful.
And I think you do have some elements of hypermobility as well. So that's probably contributed to why this has happened.
Yeah.
I'm just going to rotate the camera and I'll look at the scar on the right hand side. That's healing quite.
Probably haven't been taking the best care of it, but it was completely not noticeable at all. One little, I think, felt like one little dissolvable stitch. I haven't noticed at all. Didn't have any pain. Just had a dressing on it for I think a couple of days for water, but that's it.
So hopefully in a few weeks' time that will become invisible. Yeah. I know we've done run round of Botox post-surgery, because it wasn't just about the jaw joint itself, it's the muscles surrounding the joint which are quite tense.
Everything's seizing up.
So we've done some Botox into the forehead, into the master muscle, and just above here in the temporaneous muscle, where you're getting some irritation as well, because all these muscles head towards the jaw joint and can contribute to issues with the jaw joint. And I found everything was kind of overcompensating and clenching, and I'd wake up in the morning really, really sore from it, trying to keep it all in the right place. Yes. So we're not quite there yet in terms of the muscle tension. We might do some more Botox as part of your treatment, but I'm very happy how things have progressed so far. So thank you for taking the time to talk to me.
Thank you very much.
Really appreciate it.
Appreciate it.